Hey everyone,
Hi.
welcome. We are excited to have a guest with us tonight. We have Dr. Bernick here with us. He is the co-founder and chief scientific officer of TherapeuticsMD and a practicing GYN. But before we turn our attention to him, we have been highlighting special women for Black History Month, and we have one tonight that is making history as we speak.
Mm-hmm.
Dr. Okonjo-Iweala. Dr. Ojo Karens, would you mind telling us why you selected her?
Yes, I selected her because she's a boss. She is the first woman and first African director general of the WTO. She's a finance expert who graduated from Harvard University and also received her PhD from MIT. She has had many posts. I will just name a few. She was chair of board of Gavi, a vaccine alliance. She was Nigerian's finance minister and foreign minister. She was also managing director of operations at the World Bank. She's had many, many awards. I will just name just a few again. Fortune's 50 Greatest World Leaders. She was Time's top 100 most influential people in the world. Also received the award from Transparency International's 8 female anti-corruption fighters who inspire. So that's a lot. And again, just a little bit of what she has done. She is also a mother of 4, a grandmother, and she's married to a neurosurgeon. And so she is an amazing woman who has made history and is going to continue making history.
I'm just so impressed anytime anyone has done, like, take any one of those things. If you just said she's a lady who's got 4 kids, and I'd be like, yeah, you're doing it. So speaking of which, tonight we have Dr. Bernick with us, and just, surviving and thriving as a GYN wasn't quite enough. So you started a company with a whole suite of medications, TherapeuticsMD. Can you tell us a little bit about it?
Yeah, well, thank you. And wow, that was really impressive, that history. I'm embarrassed to have to describe what I'm doing after that. But thank you for having me. By history, I'm a gynecologist, as you said. I spent the last 20 plus years practicing general obstetrics and gynecology in Southern Florida. And about 12 years ago, I started this company called TherapeuticsMD that is focused on trying to provide common sense solutions for everyday problems that women are having, and provide easier solutions for, in this case, the medications that they're using. So we have a whole suite of products that we got approved, studied, did the research, got approved by the FDA, really covering the lifespan of a woman, starting with prenatal nutrition, under the VitaMedMD prenatal vitamin name. We have a contraceptive product that's really unique in that it's the first and only long-lasting reversible birth control product that doesn't require procedure, so that the woman can be in control of her fertility and her menstruation for up to an entire year. And we have 2 menopausal products. One product called Bijuva, which is the first and only combination of what we call bioidentical estradiol and progesterone, 2 hormones that women take together for the treatment of what commonly are known as hot flashes during menopause. And then lastly, we have a product called Invexi, which is a really exciting product because it's a more elegant solution to the treatment of what we call vulvar and vaginal atrophy, or vaginal dryness and pain associated with intercourse, and a whole host of symptoms. And it's a really nice solution. And so we have a whole host of products that, as you can see, really cover the lifespan of a woman. So it's been exciting. And, these products are available in the United States and Canada, and soon the rest of the world.
I'm going to tell you, I hear procedure free and I'm already excited. It feels like when I go to the gynecologist, there's so many things that just don't feel great about it. Anything that can make that process a little easier and more friendly, I really appreciate. And I was looking up a little about vaginal dryness, and I Googled vaginal dryness, as many of your patients might, and vaginal atrophy came up, and I'm sure that's what it is, but it's like geriatric uterus. Like, why are we using these terms? Are just so difficult. But for women who have it, is estrogen safe? This is a two-part question. Is bioidentical or natural estrogen safer than prescribed estrogen?
Sure. Well, maybe what I should do is just back up first. So you mentioned you Googled it, you looked it up. Vulvar and vaginal atrophy, sometimes we call it genitourinary syndrome of menopause, or GSM. It's a condition that's chronic and progressive. Once a woman goes into menopause around the age of 50, it's something that is a result of the lack of estrogen. And the longer she's without estrogen, the vaginal tissue starts to become thinner. There's diminished blood flow. They get narrowing of the vagina, shortening of the vagina. They may have urinary issues with it. And they get a whole host of symptoms. Collectively call it vulvar and vaginal atrophy, but it can include painful intercourse. It can include vaginal dryness. It can include itching and burning inside and outside, or bleeding during sex, and even, urinary symptoms like painful urination or recurrent UTIs. And it doesn't generally resolve on its own. Like I said, it's chronic and progressive. And the sad part is that about 1 out of 2 women, 50% of women will be symptomatic with it. And the sad part I was getting to is that very few women are actually treated for it. They tend not to recognize that there's something to do about it, or that to your first question is there safe options? And so the treatment for it generally, there's treatments that you can give just to help with some of the symptoms. Maybe with sex, you can use a lubricant or moisturizer. That doesn't tend to treat the underlying condition. But as I mentioned, it's caused by the lack of estrogen that starts at menopause. And what the treatment generally is a form of estrogen that you can give generally locally to treat the tissue. And so the question is, a common question is, estrogen safe? And the simple answer is yes, in an otherwise healthy menopausal woman, estrogen is generally safe. Those women who are advised not to take it would include women who are at risk of a blood clot, women that have a history of a breast cancer or other hormone sensitive cancer, or women that have liver disease and undiagnosed vaginal bleeding. But, otherwise, the general consensus is, from all the major medical societies, is that estrogen therapy is safe and effective for managing menopausal symptoms. And so your next question was, if I remember correctly, what are the bioidentical hormones? As I mentioned that, these two products that we have focus on bioidentical hormones. And when we use that term bioidentical, really what that's referring to are hormones that are chemically and molecularly and structurally identical to the hormones that the woman's body is naturally producing from her ovaries and circulating within her body. And so there are many forms of estrogens that a woman can take, many of which are synthetic or even come from horse's urine. Probably the most popular one that people have heard of, called Premarin, comes from horse's urine. Estradiol is the bioidentical form of estrogen, and progesterone is the bioidentical form of a progestogen that, as I mentioned, is identical to what the body's naturally producing and circulating. And the thinking is that if you give a woman these bioidentical forms of these hormones that are identical to what their body was producing and circulating, that there may be that they may be more favorable than the other forms. And the reason why there's such sensitivity to this is back in 2002, there was this landmark, study called the Women's Health Initiative. And, the reason for that is, prior to this study, we told women to go on hormone therapy as soon as you become menopausal, stay on it forever because it helps your heart, your bones, your brain, everything. And then ultimately what this study showed, that unfortunately only looked at one combination of a synthetic form of estrogen that came from the horse's urine and a synthetic form of a progestin, actually showed that there were greater rates of breast cancer, stroke, heart attack, and blood clots in those users of that synthetic combination. And since then, women and their healthcare providers, really shifted to these bioidentical forms with the thought that they may have a different profile. And, when you look at the comprehensive literature for the clinical data on the safety and efficacy of hormone therapy containing these bioidentical forms versus, as I described, the horse urine estrogen or the synthetic progestins, it does suggest that there are some differential effects between these formulations, and there may be, a better safety profile with some of these hormones. And so, ultimately, that's what women are asking for, and many clinicians are preferring those different forms.
Mm-hmm.
And so you mentioned in the suite of products you have, Invexi is one of them. And so can you talk a little bit about how it specifically works to treat the symptoms of atrophy?
Yeah, so, as I mentioned, the underlying cause is the lack of estrogen. And Invexi is a small, digitally inserted, rapidly dissolving soft gel insert. I don't know if you can see it in my fingers. It's literally the size of a jelly belly. It's inserted like a suppository into the inner outer part of the vagina. And it releases a small amount of estrogen, actually a fraction of a dose of all the other products on the market, up to 75 times lower dose than the existing products. But what's unique about it is that it has what we call a mucoadhesive. A woman inserts it, it's held in place. She can be immediately active. She could enjoy sex. There's no downtime. It dissolves without that mess that, generally the other products all come with an applicator, and they tend to be messy creams. And this is really just a more elegant treatment solution, so that they don't have to have an applicator, they don't have to have a messy cream, they don't have that messy administration. They only have to use it twice a week, as I said, in a fraction of a dose of the other products. And it treats both the inside and the outside. It treats it quickly, and women really like it, which is the great thing. So it's been an exciting product.
And to your point, I love that you use the word elegance, to describe it, because really it is a more elegant, in my opinion, as a prescriber, more elegant way to receive the medication, a lot easier. I did bring an example also of what an applicator would look like for some patients. If you were to use the vaginal estrogen cream, again, all these options, or all these products are still options, depending on what a woman would desire, what a woman wants. But again, yes, I agree with you, Dr. Bernick. It is a more elegant and easier way to apply the medication at a lower dosage. And obviously, one of the most important things when prescribing and also receiving hormone replacement therapy is to use the lowest dose possible to achieve the outcome that you're looking for.
100%. And that's why, we look to develop this product, is to do it as low doses, actually doses that were unheard of. So Invexi, by example, is in a dose as low as 4 micrograms. Some of the other products are over 300 micrograms per dose. And ultimately, as I mentioned earlier, Hannah, you have to, this is a chronic and progressive condition. So it's not something you're just going to use for a week. Generally you're going to use it, twice a week ongoing, for, the majority of your life at some point. Because if you stop these medications, eventually the tissue will dry out again. But if we can create, as Dr. Ojo-Karen said, a more elegant way to do it, so that it doesn't impact your daily activities, it's a way to stay compliant.
Well, I'm just so glad that we're having this conversation, because once again, I come into this thinking I know a little something, and then I'm like, this is just not something that is commonly discussed. I guess as a woman, when I find myself in a stage and suddenly there I am, but there isn't a great roadmap of this is what to expect, but don't worry. There are products that you can use that can help with those symptoms, but these are very common things to have happen.
That's great. I'll tell you, you talking about it in this setting is so important because most women don't know that this is a treatable medical condition, and they're afraid to have this conversation. You'd be shocked to hear that only 7% of women are treated for this condition. And I told you 50% of women have it. And, whether they don't know it exists or they're afraid to talk about it or their clinician isn't bringing it up with them, oftentimes the woman sitting in our office and, they think to themselves, oh, if this is something important, my clinician's going to bring it up with me. And the clinician sitting there on the other side saying, oh, if she's having a problem, she's going to bring it up with me. And so it's this constant standoff that gets ignored. And this is a quality of life issue. And there's no reason at this day and age that women have to suffer with a condition like this.
Yeah. Yeah.
I'm always wondering what's normal. So I don't want to complain about something if it's, I am only myself. I don't know what other women's experiences are. So whether to bring it up or not. I've got a couple questions from people who are tuning in tonight. Would it be okay if I toss them out to both of you?
Please.
One is, can phytoestrogens play a role in the management of menopause? Would they have the same effect as bioidentical forms?
And Dr. Bernick, I'd like you to weigh in on your thoughts about this question. But one thing that I do oftentimes talk to patients about is what is bioidentical, and the fact that there are bioidentical medications on the market that you can have prescribed as opposed to just compounded. I have a lot of patients who really think the only way to receive a safe estrogen is if it's compounded. And one thing I oftentimes say is that, I have nothing against compounding pharmacies. I myself have prescribed compounded medication, but one of the questions is that medication that you're having compounded, does it actually contain the exact dosage of what you're being prescribed? That's can be a challenge to really be sure of, just because of quality assurance and how products are quality assurance is done on different products. So, but yes, is bioidentical that's not compounded, and we are discussing that with Invexi. Phytoestrogens are naturally occurring plant-based estrogens, and so there are some over-the-counter medications that also have phytoestrogens. They work in the body on estrogen receptors to have an estrogen-like effect. They are not themselves necessarily the same estrogens that we're talking about, but they can work as estradiol does work. You can find some products like isoflavones, or Estrovan is like an over-the-counter that has phytoestrogens and can help with estrogen symptoms, hot flashes and such.
Yeah. That's a great answer. I'll tell you, I feel, I have the same concerns you do about those hormones, and that's why I embarked and studied and tried to get these drugs approved to have an FDA approved bioidentical combination, whether it's in the Bijuva product for hot flashes, which is 2 hormones, or the Invexi product. So you're right, there are FDA approved products, and that's important both as we talk about the phytoestrogens. So these bioidentical products are plant sourced. I should say that first, but an example could be, soy. Women could take, a large amount of soy to get that estrogenic effect. But, the concern that I have is both the efficacy, does it work, and the safety. And the important thing about drugs that we've been talking about today that are FDA approved, they've gone through the rigors of, what we call randomized placebo-controlled trials. We looked at the right dose. We made sure that there's an effect. We made sure there's a safety, and we make sure that every time a woman takes, one pill or one product or one dose, it's always the same. There's no variation in dose, because there's real risk here. If a woman's not getting the right amount of hormones, in the case of a product that has estrogen and progesterone, by example, she's at risk of getting endometrial cancer of her uterus. So, for me, it's important that, a woman is is taking a well-studied product, and to Dr. Ojo Karen's point, always getting exactly what she's expecting to get because of those risks. So, there's great FDA-approved products. Your insurance covers it, and I would prefer a woman to take, a bioidentical product that's FDA approved.
Exactly.
Okay, I've got another question. I have so many, but I've got another from somebody who's tuning in tonight. What could be attributed to a symptom of vaginal dryness for a woman under or at 40?
Yeah, so, if a woman, and I'm sorry for jumping in, but for a woman under 40, if she's gone through premature menopause, then we would associate it with vaginal atrophy, meaning she generally stopped getting her periods, or her periods are lighter or regular over those 40s. And sometimes that's common. Women, the average age of menopause is 51, but some people it's in, their 40s, some people even younger. If it's associated with menopause, it means it's, the lack of hormone production. And the interesting thing is it could be, sometimes women mistake a symptom of vaginal atrophy for thinking they have a yeast infection, and they'll come in complaining of irritation. I have itching and burning, and the clinician may do an exam and say, well, I did a culture, I don't see yeast, I don't see bacteria, and they can continue to complain about it. Or they're having recurrent UTIs, and they don't realize that, in fact, it's vaginal atrophy. A good clinical exam should be able to determine that. And so, I think it's, as Dr. Ojo Karen said at the beginning, it's going in, having an honest discussion with your clinician, tell them what your symptoms are, let them evaluate you, and then decide, what the best treatment is for you under your individual circumstances, and in this case, at the age that they may be.
There are some dermatological conditions that can happen in the vulva. And so, yeah, Dr. Bernick is right. An exam is definitely necessary, especially if it's a chronic issue. There are some chronic health conditions that can lead to vaginal dryness. These women oftentimes have issues with lack of moisture in their eyes, issues with lack of moisture in the mouth, and so they can also have lack of moisture in the vagina. So there are other chronic conditions too. So having a very good exam, also a detailed history given to your doctor is necessary to make the diagnosis.
So then I've got just one more question that I'll toss out to both of you, whoever can take it. So if a woman is estrogen avoidant, perhaps because of a prior cancer, I love that Invexi is so low dose, the lowest possible to get the squeeze from the juice, whatever the metaphor is there. But what would you advise in that case? Or is that a case by case? They should speak with their doctor.
I think one of the most important things, for us to always get across is that we talk about general, but everyone really also is a case by case. So yes, you should have a discussion with your doctor to make the best decision for you. But there are many over-the-counter great lubricants that are non-hormonal that can help with symptoms of dryness, whether it is just dryness here and there, kind of intermittent, or if it's more of a chronic issue. After you've had a diagnosis, I've talked about Good Clean Love a lot. That's aloe based. A lot of their products are, a lot of the parts of their products are organic. There are other companies that make wonderful lubricants. Replens is one. Luvina is another. Just plain aloe vera gel goes a long way as a good moisturizer for the skin. There's some people that like to use oils like vitamin E oil or coconut oil. I always, recommend kind of staying away from oils because some oils can become rancid, and that would cause, some issues with vaginitis. So just to be mindful of that. But there are really some good over-the-counter products. And there's some other good prescriptions that we didn't talk about today that are really good. Some new suppositories that are steroid-based. Interosa is one. So there are very good products out there if you are avoiding estrogens. and then even to have the conversation about the use of an estrogen, that would be, again, with your physician.
I'm so glad to know that there's so many options for whatever your path might be toward approaching atrophy. I'm gonna come up with another term, and I don't know who I will shout it to, but we've got to be another term. But it's so great to know that there are pathways through that process so that we can age comfortably and gracefully.
You know, yeah, age does not mean decrease in activity. You know, Dr. Bernick, I think you probably have the same opinion about that. A lot of women are active in after menopause, whether it be physically active, sexually active, and they shouldn't have to suffer with symptoms when there are good treatments out there that are easily accessible.
I couldn't agree with you more. Absolutely.
Well, I'm just so grateful to the both of you for sharing all this information with us tonight. I've learned so much, and I'm just so glad that you could join us tonight, Dr. Bernick. It's always a pleasure, Dr. Ojo-Kerins. Thanks for tuning in, everyone. And if you missed this here, you can catch it later on YouTube or across all of our social media platforms. Thanks,
Thank you, everybody.
everyone.
Thanks, Dr. Bernick. Thanks, Hannah.
My pleasure. Thank you.